Hi guys, sorry about that. Looks like we lost a little connection there, so we're just going to restart since it's at the beginning of the feed. Today at the Center PC, we're back for every Facebook Friday, and today we are doing DermaPeel and a PCA peel, which makes it a DermaPeel. So today Melissa is here to talk to us about that and how this is a perfect winter go-to service for you. So good morning, ladies, or good afternoon almost, right?
Yeah.
Where did the time go? Where'd the time go? All right, Miss Melissa, let's talk about what we're doing today.
So I've already cleansed Michelle's skin and put a toner on it. And what we're going to do is I'm going to take my little surgical blade and I'm going to run it across her skin very gently. It's going to pick up fine, soft, blonde hairs, and it's going to also pick up dead skin. So her skin will be exfoliated before I ever do the peel. Therefore, her peel will penetrate better. Her skin will feel like a baby's bottom tomorrow when she applies makeup.
What I love about this is you're literally getting two services in one. Yes. So normally you can do the dermaplaning by itself.
You can.
And that's really great for...
And it is a beautiful service by itself. But when you add the chemical peel to it, it's like adding the icing to the cake.
Awesome. Okay, so let's go ahead and start the process. So she's going to go...
And you can see that Michelle has a little bit of fuzz on her cheeks. And we're just going to kind of hold and just gently lift. And what you'll see... Here, let's show a little bit better.
Yeah, there we go. I can see that.
So just all that little fine fuzzy that all of us women have.
Yes, and that we can't get through laser hair removal.
We can't get through laser hair removal because the hair is blonde. Correct. And it's very fine. And so this is just an easy way, and it's a very relaxing treatment, isn't it, Michelle? Mm-hmm. Feels nice. Mm-hmm. It doesn't hurt.
Is there any downtime to this treatment?
No. And even with the peel, you just have to let the peel sit on the skin for 4 hours and do its magic. You wash it off, and the next day your skin will look amazing.
So is there any, that's always, I think the question is, will you have any type of peeling with this service?
Actually, when you dermaplane, your chances are less of peeling because you've exfoliated the skin prior to the peel.
So again, for those jumping on, because I can see the numbers are climbing really quickly here, ask questions below if you have anything for Melissa or I or Michelle. And what she's doing here, she's dermaplaning. She's getting rid of all that, what we call as a peach fuzz, that blonde skin on your hair, as well as getting all that dead skin off, the debris that you accumulate, especially right now in the winter.
Yeah. And Michelle's a little bit dry. Michelle and I talked, and she's not as faithful with her moisturizer as she should. So we're picking up dry, dead skin and also fine hair. And so when I do her peel, it'll penetrate beautifully, and all of her products are going to start working so much better because we got all of this fine hair, dead skin off.
Wow, that's amazing. Now, you did say, you know, when looking at her skin, you feel like she has a little rosacea.
She does. That's why her cheeks are red. And we have talked about it, and we're coming up with a plan. But
I like plans.
For those that have rosacea, chemical peels, PCA does a wonderful job on helping knocking back that redness.
So can we talk a little bit about what rosacea is a little bit, Melissa? Because I mean, I know people say rosacea, but I'm not quite sure. What does that actually mean?
Rosacea is when you have some of this diffuse facial redness and some broken capillaries or vessels. And usually there's a trigger to rosacea. So say you drink red wine. Your cheeks flush and they turn more red. Maybe you eat hot, spicy food, your cheeks get red. Stress can be a trigger. So if you live a stressful life...
What do you girls do to me?
Hey, we make you look even more amazing than you do right now.
The one with the red cheeks right now.
Yeah.
How stressed am I?
Apparently, you need to visit us in the spa a little more often.
Dr. Downs is full. Everybody blaming Dr. Downs. So I feel like from this angle, I can really see the peach fuzz well. because I think of the angle. So I'm really, you guys can see right here, I'm going to point like in this direction. Melissa's getting it right now. See, all that blonde peach fuzz hair is coming off, and I can see, yeah, right there.
Can you see it right on my blade?
I can. So all that's coming right off, and she's taking care of that. And now, do you feel, and this might just be an opinion, you might kill me asking this on a live video, do you feel in the winter people tend to have more drier skin because of the weather?
Yes.
So this is a perfect...
Yes, absolutely.
This would be a perfect option for everybody. And I feel like the price point is really good for those.
It is, because just to have a PCA peel, which is still a very good price point, is $125. And that includes a post-care kit. So to have this additional service that will make your peel even better, $175 is a really good price.
I would definitely think so.
And once you have one of these, you're going to want to come back every 4 to 6 weeks to have it again.
Ooh, Michelle.
Yeah. Her skin will feel so silky smooth.
Yeah, I can already tell because I can see a lot coming off, and we'll show you after she's done with her, finishing with her cheeks. I can see all of that peach fuzz and that dead skin coming right off. And it's a really simple procedure. It doesn't hurt. There's no downtime to it regarding the dermaplaning. Now there is a little, not really downtime, you just can't put makeup on after your peel, is that correct?
Yeah.
Right away.
Needs to sit for 4 hours. Needs to bake like a cake in the oven, do its magic. And then after 4 hours you can wash it off. You'll have a nice post-care kit to use after your peel. You'll use it for 5 days. A few things to know after a peel: for 48 hours, no crazy exercise, don't go swimming, don't use a hot tub, steam room, a sauna, don't use a Clarisonic. These are all things that we go over when you make your appointment or a consultation if you've not had a peel.
You hear that, Michelle? You can't go jumping in Lake Michigan this weekend.
Well, she was
telling me no
she was
marathons
really
here.
thinking about it. And she was also going to run a marathon.
I was so disappointed.
We are finished with the dermaplaning. I had worked on some of Michelle's dermaplaning before the Facebook. When you dermaplane, you would dermaplane cheeks, upper lip, chin. I always get underneath here, and you actually even do the forehead.
And so seeing some of that redness can be normal.
Yes.
See, that blade is coming.
Yep.
It's a very sharp blade.
And Michelle, she has rosacea, so her cheeks are red like this before I even touched her.
So now that you've done the dermaplaning, now we're going to do the peel. Is that correct? Okay.
We are.
So what will this peel do to Michelle's skin?
Smoother, softer, fresher, brighter. And this particular peel is going to help Michelle with her rosacea. It's going to help make her broken capillaries stronger, and it's going to help the redness that you see here. It's going to help diminish that over time. The more she does, the more you'll see. And with PCA, there is actually a protocol for rosacea. There are rosacea peels. And
Now,
that's what I'm going to do for Michelle today.
will this help with any type of like coloring, like discoloration?
Out your skin. It will help with texture, tone. It will help with your pores. It can help reduce your oil. It can help with acne breakouts. Peels are one of the best things you can ever do for your skin.
And there's different types of peels that customize for your skin. Is that correct?
So if you're really oily, we can use a different kind of chemical that loves the oil in your skin.
Now, what are we doing? What's your first step?
This is just a toner, and it's just preparing her skin to put the chemical on. And it just kind of wipes off any dead skin and any leftover makeup.
So I did want to point out earlier, Melissa talked about, you can get dermaplaning by itself if you don't want the chemical peel, or vice versa, you can get the chemical peel by itself. But when you combine those two together, you're going to get a better result. Do you feel like it's also a faster result because you're getting rid of that dead skin, that peach fuzz, and that acids are able to get down into the dermis of the skins?
Absolutely.
Oh,
And
I
one
love
thing,
this little feather thing.
before you have peel, just make sure you stop any of your medical skincare you're on. Things like Retin-A, glycolics, salicylics, any of those things, alpha or beta hydroxys. Make sure you stop those for about 5 days before you come and have one of these. And if you have a history of cold sores, let us know and we can certainly get you a prescription so you don't get a cold sore.
So this is I'm assuming is an acid maybe?
This is the DermaPeel acid. The kind of acid it is called a TCA,
Okay.
which also helps with anti-aging. It's good for all skin types. And it loves rosacea and redness. So,
Which means it's going to help, right?
yes. And the more peels you do, the more you'll see. So many of my patients see me every 4 to 6 weeks, and some of them have seen me for years.
Wow. Now, is there any like downtime? I know we've been talking about that. Any downtime? I mean, besides the 4 hours and then washing her skin afterwards.
She might have some potentially light flaking, but that's it.
Awesome. So she could, since it's like 12:30, she could go out to dinner tonight, put her makeup on, and go out to dinner if she wants.
Absolutely. Yes. She could wash her face off about 4:30, 5 o'clock, and she can go to dinner wherever her husband wants to take her.
You hear that, Gordo? Taking Michelle out.
So we've put this layer of chemical on, and you can see it just looks a little shiny. Michelle, how does that feel on your skin?
A little tingly.
A little tingly. Scale of 1 to 10, 10 being the most uncomfortable. Where would it be?
It's not uncomfortable. It's just, I mean, like,
tingly?
yeah.
It reminds me of like little spices on your skin. Like,
Michelle, if you want, you can hold this little fan, and the fan will just help take all that little bit of tingle away.
so does the tingle mean it's working?
It's working, and it's normal. It's acid. It's gonna have a little tingle to it, but it's okay. The fan actually makes it feel better. Does that make
It does feel better, yeah.
And do you feel because you did the dermaplaning before, it's going to be a
It's
little
a
more?
little more tingly because of the dermaplane.
Okay.
Because you took all the hair off, so that chemical's sitting right on the skin.
Wow. Oh, so you're so great.
I try, thank you.
So a little bit, because you guys know, I know you know Melissa, but let's talk a little bit about you, Melissa, and talk a little bit about your credentials. So you do have a background in dermatology a little bit. You've been an esthetician for 10 plus years.
Correct.
And you've actually, you've been in a medical spa field for what?
About 5 years of my career.
Yeah.
5-6 years of
So
it.
she definitely has a very eclectic background that I
Yes.
love. And I love that because you did have a little dermatology background. So you definitely
5.5 years of it. So
seen different types of skin.
yes.
So Melissa is one of our master estheticians here, and she does do laser work, but you specialize in the peels.
Yes. They are definitely my passion.
And skincare.
Love peels and skincare are my two things I really, really love.
And that's what's so great about, coming to the Center PC is because we do, we have experts here that really have had a lot of different experience and an eclectic background like yourself, Melissa.
Absolutely. So what I'm doing now is I'm going to put some serums on Michelle, which will help customize her peel, especially for the rosacea, and it will actually make her peel work even better because the serums allow the chemical to be driven deeper into the skin.
So what type of serums are we doing today?
The first thing I used was a hydrating serum because Michelle's dry and she's been naughty and not used her moisturizer.
Michelle!
And so that's going to help hydrate her skin a little extra. Then I'm using this serum that's called anti-redness serum. And anti-redness serum can be used on anyone. But on a rosacea skin, it loves these broken vessels and the redness of the skin. And it will help calm that skin down because it's loaded with chamomile.
Ooh, Michelle.
I know.
And then I'm going to use a rejuvenating serum, which is also for rosacea, but it's good for general anti-aging, and it has a little bit of a peppermint smell. And
I was just going to say, that smells good.
Amazing.
And peppermint's supposed to calm your skin, is that correct?
Yes.
Okay.
So she will love how this feels.
See, I know a thing or two every once in a while.
You do. You've worked here just a few years, Shayna. So
Every
you
once in a
know your
while.
stuff. Then I'm going to use this product. It's called Clinicalm. It has some hydrocortisone in it, and it's going to calm all the tingle that she feels.
And now she's going to keep this on for 4 hours.
Yes.
Okay. And then after that, she's going to use her post kit, which we're going to show you guys.
Yes.
Now, I know we talked about a little bit about, you know, you want to get Michelle on a skincare regimen. What are some of the skincare items you feel that she's going to use in the future?
Number one thing that Michelle will use, and we've already talked about it, is she will use a daily sunscreen without fail. Because of her broken vessels and the redness in her skin, when she doesn't wear sunscreen, the ultraviolet light actually keeps her more red. And it keeps her vessels really apparent and close to the skin.
Right.
So she has to wear sunscreen unless she decides to move to a cave. And then she doesn't have to wear sunscreen. And any of my patients know that they will wear sunscreen because that's the rule.
That's the rule.
I worked in dermatology, always remember that. And I would like to see her use a product out there called Rosatrol. Rosatrol is a product that likes rosacea and it likes redness in the skin, and that would very, very much benefit her.
And that's something we carry here. And
yes.
I don't know the price point of that. It's pretty
it's
reasonable.
It's in the $60
yeah, that's what I thought,
price
60.
point. And you use a small pea size. So you're going to have it for months, and it's made by ZO. So it's a great product.
And that's something you can only get in a medical facility.
Spa.
So you cannot find that online. You can't find it on Amazon. You have to come here to get that.
And you want to come here. You don't want to buy your skincare offline. How do you know that it didn't sit in a 90-degree closet and it was spoiled? You want to come here where there are professionals that can help you navigate your issues and figure out what you need.
Okay, so now you've put on her calming
And sunscreen and moisturizer.
And moisturizer. So that's pretty much it. And look how quick that was. I mean, this procedure can be done, what, less than an hour?
With dermaplaning, I would give it an hour, a little bit more. Just because, you know, we don't like to rush our patients. We like to take our time and give you an experience as well as a great treatment.
So how do you feel so far, Michelle?
Good. Refreshed.
Yeah. Refreshed. Any tingling? Anything like that? Do you feel hotness, redness? Awesome. Do you feel tight? I feel like does the chemical peel make your skin a little tight?
I feel like it feels a little bit tight. Just a little bit, but I felt like that was because it was the fan and everything.
Yeah. As it dries down, it feels tight. And just to kind of show you guys, this is your post-care kit that you get when you have a PCA peel. And this will have, sorry Michelle, this will have all of your products that you need for 5 days. And their PCA is wonderful. They will include all of your directions, and they will remind you of the things you're not supposed to do for 48 hours after.
That's really nice.
Plus, any of our providers here, we're going to go over this in detail and teach you how to use it so you'll know what to do. And these are amazing products.
And I love that. So, you know, for you guys, just information, so whenever you have a PCA pill, you're getting skincare with it that's going to help enhance your treatment for 5 days. And then you're going to come back, see Melissa, and then she's going to put you on a skincare regimen and get you continue doing peels, lasers, hydrofacial, whatever she feels
you need.
Your treatment needs. So,
and with, you know, anyone coming here, we're going to listen to what you want, and we're going to try and get you great results.
Perfect. Well, thank you, Melissa. Thanks for taking time to show us our DermaPeel. We've never actually videoed before.
So come and see me, everyone.
Yes, come see us. And if you have any questions, comment below, and Melissa and I will try to answer them throughout the day. All right, you guys. So again, that was DermaPeel. That's dermaplaning and a chemical peel put together. And if you guys have any questions at all, come see us or give us a call, 574-968-3510. Or you can email us, go on the web, Facebook, whatever. We'll definitely answer all your questions for you. Or the best thing to do, too, is just come in, have a consultation with Melissa, Tiana, Courtney, Emily, then our nurses. They can definitely help you with any type of skincare problems, or if you want to have anything else you want to talk about with them. Again, hope you guys have a great weekend, and we'll be back next Friday. Bye, guys.